weakness, numbness, and pain from nerve damage. We're talking about peripheral neuropathy. Here to tell us more about the symptoms and what we can do about it is Dr. Richard Busch. Thanks for being with us today.
Thank you for having me.
So kind of explain what that is first.
All right, well, first of all, peripheral neuropathy is very simply death or damage of a nerve. Okay, that's in a nutshell what it is. And it comes from a couple of different things. Most commonly diabetes, sometimes from toxicity in the environment around us, like pesticides, herbicides, petroleum products, that type of thing. Sometimes it may be even a drug interaction. Sometimes it's idiopathic, which means we don't know what caused it, all right? And then along with that, things like HIV, AIDS, and chemotherapy can also be causes. But what somebody might feel is they might start out feeling numbness and tingling or even a burning sensation, and sometimes they get sharp shooting pains. Other times, it may just feel like their foot's wrapped in cellophane with a bunch of duct tape around it, and there's a lot of pressure. The biggest problem that we see with most patients is that, you know, the number one cause of serious injury for patients over the age of 60 is a fall. The number one cause of death for patients over the age of 65, or that may not be the number one, but it's extremely high up there, is a fall. So we have to keep an eye on that type of thing, and so it can be very dangerous for people that can't feel their feet to walk around.
Absolutely. And what can we do about
Well,
that?
what we're doing is a combination of several different types of treatment. Number one is nutrition, okay? So we can actually work to help, especially with those diabetic patients, reduce their blood sugar levels, increase their blood supply. And then along with that, some other nutritional supplementation. But then we also are using low-level light and laser therapy. And then we're also using some other therapies at home that they can do as well to help them get better. So it's not just a single approach. It's actually a combination of several different things that we've done.
Well, and like you said, that really can affect your life. Is it in your hands or feet is where you would feel that?
Actually, it shows up in the feet first, and then a lot of times it will show up in the hands as well. Generally speaking, as far away you can get from your central nervous system is where you're going to start to notice it first. And what we're dealing with peripheral nerves is we're dealing with the smaller nerves in our body. They're the most delicate. So things like lower oxygen levels will actually affect those. And sometimes some of these medications or some of the other things might be what are called mitochondrial toxins, and they shut the ability of that cell down so that it can't actually make the energy it needs to function properly. And so what we're doing is we're working to actually reinstall that type of thing, increase blood supply, increase oxygenation to those nerves so they can heal. And then along with that, also making sure that we're actually increasing the ability of that cell to make its own energy.
Yeah.
And that's why what we do works.
Yeah, and definitely you don't want to have to live with that kind of pain. So see you about it.
Give us a call.
Perfect. Dr. Busch, thank you for coming in.
Thank you very much.
You can find out more about Busch Chiropractic by calling the number there on your screen. Pat will send it back to you.